So, for the musculocutaneous nerve injury, and the pathology of this injury can be brachial plexus damage, compression injury, dislocation of the shoulder, and also entrapment of the nerve at the elbow. So, for the examination and results, okay, first, we will do the VAPs, so that we can know the scale of the pain of the injured site of the patient. And then, next is the sensory assessment. So, with the pinprick sensation, you will ask the patient to comfortably put the hands sa table, and then, nagsit si patient. So, ma'am, with this, ma'am, kay gamito na itong pinprick sensation, but ayog ka balaka, kay dili na siya sakit nga makasamad na. So, agbuhatan na ni, we would test for this sensation kana pulo, pero dili ra sa kamot. So, kaning duha, left and right. So, inga ni ma'am, mo close imong eyes, then, ayun na paghuwat og cueing nga. Okay, ma'am, nakay na feel, so di na kamahuwat, og nakay na feel, sulti lang, i-verbalize, og nakay na feel, o wala. Then, kung asa, left or right ba. Okay? So, that's for the sensory. Hinga na, diri, close ang eyes ni patient. So, there is a loss of sensory below the elbow on the lateral side of the forearm. So, for the MMT, we'll test for the flexion of the shoulder and the elbow. So, with this, we'll ask our patient to sit down sa table or sa bed. Sit down sa bed. Then, so first, we'll ask the patient to bring their whole arm close to their dunggan, and then while doing that, ma'am, I will apply resistance and don't let me push you down, okay? Okay. Then, ang PT kay nasa likod si patient and stabilizing sa shoulder sa patient. So, that's for the shoulder flexion. Next is the elbow flexion. So, ma'am, I want you to put your palm nga naa sa babaw, facing up. Then, with anang relax siya sa imong shoulder, and then bend your elbows, ma'am. Then, I will apply resistance, same as before. Don't let me push it down. Okay? Sa makaya na nimo, ma'am. Then, after that, we will ask the patient to ikulob ang kamot, then i-bend gihapon. Then, I will apply also resistance. Okay, ma'am, ayaw ko sugting nga ma-push na ko yung kamot. So, sa MMT, there is a weakness on the affected side of the patient. So, next is the ROM. So, we will test for the shoulder flexion, elbow flexion sa ato ang patient. So, ma'am, this is the goniometer. This is for testing or kanang matest ato ang angle of okay pa ba ang range of motion. So, ibutang ang ato na ipesto. So, ma'am, first kay katong bring imong whole arm close sa imong dunggan. Okay, so sa asa ra makaya nimo, and I will just assist you, ma'am. Okay, ma'am. So, katulot na, ma'am, ha? Okay, so relax. Take note the degrees. Next, ma'am, ikaduha. Then, ikatulo. So, with that, i-take note ang mga results. So, next is the elbow flexion. Sige, ma'am, I want you to flex or bend your elbow. Then, ako sa ibutang, ma'am, ha? Sige, 1, 2, 3, go. Okay, good. So, for the ROM, there is a decrease in the ROM. So, next is the functional assessment or the ADEPT. So, with this, we will ask our patient to simulate dressing sa upper extremity and the lower extremity. Simulate sa patient sa eating and personal hygiene. So, with this type of injury, kay lisod ni para ni patient. So, ma'am, so I want you to sit comfortably here. So, for your next assessment, I want you to simulate or saan ni mo nigsuot og sanina sa imuhang or magsuot og blouse, ma'am, then magbutunis. Saan man nimo, ma'am? So, simulate or ipakita na po, ma'am. Sige, suot ni patient and then butunis. So, after that, ma'am, nag-sit gihapon ka Saan man mo nagsuot og short or pajama sa tiil. Okay, good. So, next is, next ma'am, I want you to simulate o kung saan mo ni crown using spoon and fork. Okay, good. Then, lastly, saan mo nigdo sa personal hygiene. Okay, good. So, for the special test, we will do the speed test. So, ma'am, na ako'y test nga ipabuhat. Ang imong buhaton kay bring your arms into a straight line. Okay, straight line or 90 degrees. Then, but neutral na ram ha. Ang imong cam kinasa babaw. Then, relax siya ka. Then, nana sa 90 degrees, I will put resistance here sa imong biceps. Then, ako i-push down. Okay, ina ako may sakit or wala. Okay, good. So, the speed test is to rule in or rule out the superior labral tears or bicipital tendinitis. So, that's for the examinations and result. So, for the plan of care, first is the patient education regarding the condition of the patient and safe movement to avoid the risk of injury due to sensory loss. Okay, that's the first. So, next is the ice pack on the anterolateral forearm for 10 minutes to decrease the pain of our patient. So, with this, here, so ma'am, we will apply, so imagine this is the ice pack. So, ma'am, I will put some ice pack sa imong kamot for 10 minutes, but don't worry, after 5 minutes, I will have to check you if okay pa ba or nakapakay na feel. So, tas ma'am ha, na feel ni magkapugnaw ma'am. So, okay, good. So, ice packing sa side nga na ay pain ni patient, and then from 5 minutes kay mo check ta, ma'am, how are you? Naka-feel pa ka? Do you feel any pain? Okay, I will check the patient's skin if naabay na muwa o wala. So, after sa ice pack, kay mag-gentle stretching ta sa shoulder and elbow flexor sa ato ang patient. We will do this for 30 seconds hold and for 2 sets. Okay? So, para ma-increase ang tissue extensibility sa atong patient. So, first, ma'am, we will stretch your shoulder. So, can you put your right arm across sa imong body? Okay, cross. Then, okay, sit. Okay, cross. Then, inga na. Then, gentle ra, ma'am. Sa kuan yan, dili na mo sakit. So, kung asa na ko to magsakit, so, hinay-hinayo lang stretch. Okay, good. Okay, and after that, we will ask the patient to isaka or pasaka ang imong kamot. Then, ako ay ibutang ang distance. So, kung asa na dapit ang sakit, so, yan na. So, next, for the gentle stretching, we'll ask our patient to sit down, and there's gonna be table or a bed nga sakto na sa katason sa shoulder sa patient. Then, there's a towel. And, ma'am, I want you to put your kamot sa towel. Then, kumuta. So, with this, ma'am, I want you to let your both arms slide forward. Then, i-bend ang imong waist forward. Yan na. Para ma-stretch ang imong shoulder. There's a 30 seconds holds 2 sets. So, that's for the gentle stretching. And then, next is the isotonic OKC exercises of the shoulder and elbow flexors and forearm supinators with 2 pounds dumbbells for 5 repetitions, 2 sets to improve the muscle strength of the affected muscles to promote muscle hypertrophy. So, imagine this is the 2 pound dumbbell. So, let our patient to do elbow flexors and shoulder flexors exercise. Okay? So, bali, mag-dumbbell ka, ma'am. Ingan na. So, you will do that for 5 repetition, 2 sets, while ang PT kay naka-supervise or nasa likod ni patient, tag-assist.